Now that we've done all the reconnaissance, now that we've done our plan, we got our plan together, we got our strategy, before we march into battle, let's assemble a team. Find out who your community makes rounds there. Who are the nurse liaisons? Who are the people making rounds at this place? That is super important because we're going to talk about shadowing them, all right? One of the things that I teach all of our clients with Power Partners is to create combined programs. This is very advanced because you got to have those Power Partners. Once you really get those Power Partnerships, you can create a readmission initiative working with your home health or with your hospice companies, or make that into that you can program that I showed you, right? You can do that kind of stuff with your referral partners. And then you go together. You co-market. It's hard to kick two people out, especially if you have somebody who's a power partner of yours who's already in there all the time. It's one of those nurse liaisons. They're always in there picking up clients. You can totally go in with that person and shadow that person. Do that multiplier effect that I taught you all yesterday. And this is how you do it. Schedule them out, and you got to commit to it. That's a big thing. You got to commit to it, because I've seen people start to do it and then it doesn't happen right away, and then they give up and they end it. No, you have to commit to this. Like, what is a commitment? Like, we're going to make this program and we're going to go out and we're going to promote it for the next 6 months before we take a look at our results and see what happens. That's a commitment. It's a commitment of time, it's a commitment of resources, it's a commitment of energy, and it's also a commitment of possible frustration. But this combined program, this commitment to each other, when you go out there and you're doing this, and you're putting it out there, we're going to do this, we're going to do that. When the home health gets the referral, and then they see that this is somebody who's perfect for your combined program, they call you while they're sitting there with the patient. All right, that's a big one, right? I'm glad you wrote that up. Write that down. The nurse liaison, write that down. I'm going to say that again. The nurse liaison is the one who should call you immediately when somebody could use what we do as part of this combined program. Don't wait until the person comes home and the social worker gets involved. It's too late then. Let me ask you something, folks. How does somebody know that it's a readmission? How does somebody know if it's a safe discharge or not? An unsafe discharge, they know it's an unsafe discharge when that person is now in the ambulance going back to the hospital. It's too late when the person's home. If we're going to make an impact, if we're going to help improve outcomes, which is what we want to do, that's why we're all here. If we're going to do that, we have to make sure we do it from the hospital, discharging them home immediately, and wrapping around that Medicare benefit. For my private pay folks in the room, a great combined program. You know why the home health like this combined program? Because from a Medicare standpoint, they have 2 full days, 48 hours after the discharge, which means if I get sent home from the hospital today, not tomorrow, Friday, not Saturday, but by Sunday, somebody will come out and see me. Now, if I had a massive stroke, I'm 85 years old and live by myself, what am I going to do for the next 2.5 days? Try to help myself and get hurt and be back in the hospital. But if that home health was smart and they brought in a power partner and a combined program, the private duty, although I'm paying for it, they could even pick me up from the hospital, bring me home, and set it up all the way through the home health coming in 2 days later. It makes sense. This is kind of like those this is like a gateway into preferred provider groups that I was talking about yesterday with you. You always hear me talk about this. I always say everything goes back to power partners. It all comes back to power. You want to get into hospitals? Power partner. You want to get into skilled nursing facilities? Power partner. You want to double and triple your business like all of these folks here? You want to win one of these awards, right? This category. We want to win one of these. You got to create power partners. It's as simple as that, which is very difficult, right? But that's what it is. And then you commit to each other and you make this happen. You commit to that combined program, and then be ready for this. This was one of my favorite things about hospital marketing. By the time I went to Robert Wood Johnson Hospital and Central State Medical Center, I was already receiving referrals from every single referral source that they feed. So every SNF, every CCRC, every home health, every hospice, every medical equipment company, all of the people that the community, they were all referring me business. And the hospital feeds all these folks. So many a time I'd come in and say, Alita, I'm being introduced to you. I'm shadowing with Tom here. And Tom introduces me to you. You're the director of case management. And this is Steve. He's my power partner. We have this great combined program, blah, 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 blah. We'd love to talk to the rest of the team about it. Oh, hi, Steve. Nice to meet you. Yes, we put this program together. I know I caught you at a bad time. We literally just walked in here. Can I schedule a time to come back and see you one-on-one and go over this program with you? Tom could come with us. While that's happening, because this happened all the time, while that's happening, Robin comes walking in to see Alita. And Robin's like, oh, and you see Robin, and you're like, oh, hi, Robin. And Robin goes, oh, Steve, what are you doing here? Oh, my goodness. Oh, 1 second, Alita, I'm sorry. Hi, good to see you. Oh, yes. How are things going? How's the husband? Oh, we love that guy. He's a good man, right? How's everything go? Awesome. I've been seeing you in like 6 months. Now, you know what happens when that happens right there? Alita's like, wait a second. I want that, right? Yeah, I want that kind of relationship, right? No, I know Robin for 15 years. I've referred her thousands of patients over the last 15 years. How have I never heard of you? I also know Tom for 5 years. And this is the first time I'm meeting you. And then all of a sudden now, this drop-in visit, because of chance, all of a sudden now this becomes a 5-10 minute thing. Then all of a sudden Sadie shows up. And Sadie from, John Doe Amazing Skilled Nursing Facility, right? And you come in, hi, Alita, Steve, what are you doing here? Oh my goodness. And you're just like, you're literally overwhelmed. You're like, you know everybody. Well, if you refer and work with everybody else, then we want to work with you too. That's what happens when you develop your territory. It happens for many of my clients too when that happens, because it's beautiful. That's the best case scenario. So go into it prepared for that by knowing our community.